Speaker, my question is to the Prime Minister. Prime Minister, the Mercury newspaper reports that there have been no unannounced safety checks at Tasmanian residential aged care facilities during the COVID-19 pandemic. By comparison, the aged care regulator has carried out 63 unannounced visits in New South Wales, 63 in Victoria, 55 in Queensland and 20 in South Australia. In other words, the federal government is flying blind in Tasmania and hoping for the best, which amounts to willful and dangerous ignorance considering what we've seen in aged care elsewhere. Prime Minister, how can older Tasmanians feel safe in these circumstances? And how does the government explain the lack of inspections? And what are you going to do about it?
The Prime Minister has the call.
Thank you, Mr Speaker, and the Minister for Health may wish to add to this answer. This is a matter, Mr Speaker, that I've been speaking directly with the Tasmanian Premier about. Of course, the Aged Care Quality Commissioner undertakes their processes in relation to Tasmanian facilities, but I also know, Mr Speaker, that through the work that is being done through the Minister for Aged Care and agreements that we've been able to reach with the Tasmanian government, will be working through the very issues that you have highlighted. You're right to raise them, and it's important that this is undertaken. It's happening all around the country, and it will also happen in Tasmania. But the Minister for Health may wish to add to that answer.
The Minister for Health has the call.
Thank you very much, Mr Speaker, and I'm pleased to add to the Prime Minister's answer. On the 31st of January, the Department contacted aged care facilities around Australia with early preparation. All aged care facilities were contacted. That then followed in terms of actions which were taken on the 7th of February in relation to aged care facilities being contacted around the country. In addition to that, on a national level, what we've seen is that the 6th of March, the Minister for Aged Care and the Chief Medical Officer convened the Aged Care COVID Preparedness Forum, which was open to aged care facilities around the country. In addition to that, I'm advised that the Aged Care Quality and Safety Commissioner has indeed been in contact with all facilities around the country. That includes both direct interviews. A number of those facilities around the country were deemed not ready in preparation in March off the basis of that, and standards were lifted and addressed across the country. In addition to that, and that was in relation to all aged care facilities, a further survey has been conducted by the Aged Care Quality and Safety Commissioner of all facilities with subsequent and additional contacts around the country.